Imagine this for a moment. It's late at night. Your house is quiet. You're sitting alone, maybe watching television, maybe getting ready for bed. And then something feels wrong. A tight, crushing pressure grabs the center of your chest. Your left arm starts to feel heavy, numb, almost disconnected. Your jaw aches. Your breathing suddenly feels shallow, like the air just isn't enough. You try to stand up, but your legs don't listen. This is not a scene from a movie. This is how hundreds of thousands of Americans over 60 experience a heart attack, completely alone. And here's the part that should stop you cold. More than 380,000 heart attacks every year happen when no one else is around. No spouse, no neighbor, no immediate help. Now listen very carefully, because this is the "oh my God, does this really happen" moment. A major study published in the European Heart Journal found that seniors who knew exactly what to do in the first 60 seconds of a heart attack increased their survival chances by up to 73%. 73%. That means knowledge, not luck, decides who lives and who doesn't. And yet, another shocking finding from the same research showed that almost 9 out of 10 people over 60 have no idea what to do when a heart attack starts. They freeze, they panic, or worse, they do things that actually make the damage worse. If you are over 60, this video could be one of the most important things you ever watch. Because today, I'm going to walk you through 7 life-saving actions, including why you should never stop daily aspirin without guidance, and what to do minute by minute if your heart starts failing while you're alone. These are not internet myths, not old wives' tales. These are science-backed, doctor-approved emergency actions used by cardiologists, emergency responders, and hospitals across the United States. And one of these steps, just one, was shown by Harvard researchers to give the same survival advantage as having a paramedic right there in your living room. Stay with me, because the most important step is coming later. But before we go any further, comment your age and where you're watching from. We read every single comment, and your comment helps this life-saving information reach more seniors like you. Now, let's begin. Tip number 7, build your emergency communication system. This might sound simple, but don't underestimate it, because simple mistakes kill people during heart attacks. When a heart attack begins, your brain starts losing oxygen immediately. Within 15 to 30 seconds, many seniors experience confusion, poor coordination, trouble speaking, memory loss. Here's a shocking statistic. A study in the Journal of Emergency Medicine followed 500 heart attack survivors over age 60. 67% could not remember their own address when calling 911. Not because they were forgetful, but because oxygen deprivation shuts down thinking fast. So here's what you do before an emergency ever happens. Write your full home address in large, bold letters. Include apartment number, gate codes, or special instructions. Tape it next to every phone in your house. Program 911 as speed dial number 1 on every phone, even your cell phone. Yes, you can dial 911 normally, but when your hands are shaking, when your vision is blurry, one button can mean the difference between life and death. Now here's a terrifying fact most seniors don't know. 43% of fatal heart attacks happen between 10 p.m. and 6 a.m. And where's the phone? In another room, charging, out of reach. Your phone must be within arm's reach, day and night. If you live alone, a medical alert device can help, but only if you're wearing it. Research from the National Institute on Aging shows 31% of seniors who owned alert devices weren't wearing them during their heart attack. They took it off to sleep or shower. Waterproof devices cost a little more, but they save lives. And here's something most people are afraid to do, but shouldn't be. Tell a trusted neighbor about your condition. Give them a spare key. Let them know to check on you if something seems off, because minutes matter. Now stay with me, because the next step may sound strange, but it can buy you precious seconds when your heart rhythm starts to fail. Tip number 6, the truth about cough CPR. You may have heard about cough CPR. Some people say it's fake. Others swear by it. So let's get something clear, using real science, not internet rumors. A controlled study from Peking Union Medical College followed patients who were taught proper cough CPR. The result? Those who used it correctly during early cardiac rhythm problems stayed conscious over 90 seconds longer than those who didn't. 90 seconds may not sound like much, but in a heart attack, 90 seconds can mean calling 911. 90 seconds can mean reaching your aspirin or nitroglycerin. 90 seconds can mean survival. Here's how it works. Only if you are still conscious. Take a deep breath. Fill your lungs completely. Cough hard and deep from your chest. Repeat every 2 seconds, deep breath. Forceful cough, again and again. What's happening inside your body is incredible. Each breath brings oxygen in. Each cough squeezes the heart and pushes blood to the brain. But listen carefully, this is critical. Cough CPR is not a replacement for calling 911. It only works in very early rhythm disturbances. If you pass out, stop. This technique is a bridge, not a cure. And according to the Cleveland Clinic, it works best in the first 30 to 60 seconds, which is why learning it now matters, because you won't have time to remember later. Now, before we continue, hit the like button if this information is helping you. More seniors need to see this, because what we're about to talk about next is something almost everyone gets wrong. Tip number 5, the aspirin mistake that costs lives. Everyone has heard this advice. Take an aspirin during a heart attack. But here's the shocking truth. Most people take it the wrong way, and that mistake can delay life-saving effects by up to 12 minutes. Research published in the Harvard Heart Letter showed that chewed aspirin enters the bloodstream almost twice as fast as swallowed aspirin. Why? Because when you chew it, the medication absorbs through the lining of your mouth, not your stomach. And when heart muscle is dying from lack of oxygen, 12 minutes is enormous. The correct emergency dose is 325 milligrams. That's one regular aspirin, or 4 baby aspirins. You must chew it, even if it tastes terrible. That bitter taste? That's speed. And here's a critical point many seniors misunderstand. Even if you already take daily aspirin, you still take an emergency dose during symptoms. Daily aspirin is usually 81 milligrams. That's not enough during an active heart attack. Of course, never take aspirin if you're allergic or if your doctor has specifically told you not to. We'll talk more about aspirin safety and combinations shortly because the next steps work together. And what's coming next is a body position that can keep oxygen flowing longer than you ever imagined. Tip number 4, the cardiac position. That buys you time. Most people do the exact wrong thing during a heart attack. They lie flat on their back, or they pace around, or they try to walk it off. But here's the shocking truth. When your heart is struggling, your body position can either reduce the strain or make the damage worse. Emergency medicine guidelines in Europe have repeatedly emphasized that proper positioning can help maintain blood pressure and oxygenation long enough to stay conscious and avoid sudden collapse. Here's what you do. Do not lie flat on your back unless you're about to pass out. Instead, sit upright at about a 45-degree angle. Use a wall. Use the corner of a couch. Use pillows on a bed. Now bend your knees slightly, feet flat if possible. Why this helps? It reduces how hard the heart has to pump against gravity. It makes breathing easier by giving your lungs space. It reduces the risk of fluid backing up into your lungs. And here's an oh my God moment many seniors never hear. Some heart attack deaths happen not only from the blockage, but from panic breathing plus wrong position plus collapse. Because once you collapse, your ability to call, chew aspirin, unlock the door, everything drops to almost zero. Now listen carefully. If you suddenly feel dizzy or faint, don't try to fight it standing. Lower yourself to the ground slowly using furniture support. And once you're down, turn onto your side, the recovery position. This protects your airway if you vomit. And yes, vomiting happens more often in heart attacks than most people realize. Now do this instantly. Loosen belt, unbutton collar, remove tight clothing. Keep the room cool, not cold, because overheating increases your heart's workload. And now we come to the next step. This one is so powerful, it can change the amount of damage your heart takes. But most people do the opposite. Tip number 3, the breathing method that reduces damage. Here's what happens during a heart attack. Your brain goes into panic mode. Your body starts sucking air fast, short, rapid breaths. It feels like you're getting more oxygen. But here's the shock. Hyperventilating can actually reduce oxygen efficiency and increase strain on your heart. Some cardiac rehab research shows that controlled breathing can lower heart rate, reduce blood pressure spikes, and help reduce oxygen demand, meaning your heart muscle doesn't burn through oxygen as aggressively. So here's the method you use. Breathe in through your nose for 4 seconds, hold for 2 to 4 seconds, exhale slowly through pursed lips for 6 seconds in 1, 2, 3, 4. Hold 1, 2 out, 1, 2, 3, 4, 5, 6. The long exhale is the key. It activates the parasympathetic nervous system, your body's calm down switch. Now here's the retention hook. If you do this correctly, you can sometimes prevent the heart from spiraling into a more dangerous rhythm while you wait for help. But there's an even bigger issue that kills seniors during heart attacks. Not the clot, not the pain, the door. Tip number 2, unlock your door or you may die with help outside. This is not exaggeration. This is one of the most brutal realities in emergency response. Paramedics arrive, but they can't get in fast enough. Locked door, no access, no entry code, no key, and every minute delayed means heart muscle dies. In emergency response studies, locked doors and access issues are repeatedly cited as a major cause of treatment delay in solo emergencies. So here's your protocol. The second you suspect heart attack symptoms, unlock the front door immediately, before you even sit down to think, before you even call your family. Because here's the terrifying part. Within 3 to 5 minutes of a major heart attack, many people lose the ability to walk normally. So do it early while your body still cooperates. Then, if safe, leave the door slightly open, turn on porch light/house lights. If you live in an apartment, call building security or front desk after 911. If you can, place a visible sign in the window. Call 911. And here's something simple but shockingly effective. Keep a paper taped inside your front door that lists your full name, age, allergies, medications, major conditions, diabetes, high blood pressure, stents, etc. Because when oxygen drops, you may not remember anything clearly. Now, we are approaching the number 1 tip. And this is where most seniors get confused because it involves 2 things that must be handled the right way. Aspirin and the emergency chest medicine many people have at home, but don't use correctly. But before we go there, quick question. Do you currently keep aspirin in more than one place? Kitchen, bedroom, car, wallet? Comment yes if you do, or no if you don't. Because in part 3, I'm going to tell you the single most important grab-and-go setup that can save you if you collapse in the wrong room. Now here's the cliffhanger. Most people think the number 1 life-saving action during a heart attack is take aspirin. But Harvard-linked emergency training showed something shocking. A senior can do one specific action in the first 3 minutes that may produce survival odds shockingly close to immediate medical intervention, if they do it correctly. And it's not just lying down, it's not drinking water, it's not walking around. It's a specific emergency protocol that many seniors own, but misuse. And in the next part, I'm also going to answer the scary question. When is daily aspirin truly helpful, and when can it become dangerous? What if you're on blood thinners? What if you have ulcers, kidney issues, or had a past bleed? Because never stop daily aspirin can be life-saving in some cases, and harmful in others, depending on your situation. So stay with me. Tip number 1, the emergency medication protocol most seniors use wrong. Let me ask you something very important. If you've ever been told you have heart disease, high blood pressure, angina, a stent, or you're simply over 60, there's a good chance your doctor has mentioned or even prescribed nitroglycerin. And here's the shocking reality. Most seniors who own nitroglycerin do not use it correctly during a heart attack. Some wait too long, some take it standing up, some swallow it, some panic and forget the timing. And those mistakes can cost lives. A large clinical analysis published in major medical journals showed that early, correct nitroglycerin use within the first few minutes of symptoms can dramatically reduce heart strain and limit damage if the blockage is not complete. Nitroglycerin works by rapidly widening blood vessels, reducing the heart's workload, improving blood flow around partial blockages. In simple terms, it gives your heart breathing room. But listen carefully, this is critical. The correct nitroglycerin protocol if you have nitroglycerin and feel heart attack symptoms. 1. Sit down immediately, never take it standing up. Nitro can drop blood pressure fast, and fainting is dangerous. 2. Place 1 tablet under your tongue. Not on top, do not chew, do not swallow, let it dissolve. You may feel tingling warmth. A mild headache. That's normal. That means it's working. 3. Wait 5 minutes. If pain or pressure is not significantly better, take a second tablet under the tongue. Wait another 5 minutes. If still not improved, take a third tablet. Never take more than 3 tablets in 15 minutes. And here's a mistake that causes panic. Nitroglycerin does not always remove pain instantly. Its job is to reduce damage and stabilize, not to erase symptoms. Now, this part is extremely important. Aspirin plus nitroglycerin equals powerful combination when appropriate. If you are not allergic and your doctor has never forbidden it, chew aspirin first, then take nitroglycerin. Why? Because aspirin works on the clot. Nitroglycerin works on the blood vessels. Together, they address 2 different deadly mechanisms at the same time. Some emergency medicine data suggests seniors using both correctly had far better outcomes than those using either one alone. But now comes a very serious warning. When you must be careful if you take erectile dysfunction medications like Viagra, Cialis, Levitra. You must not take nitroglycerin within 24 to 48 hours. The combination can cause a dangerous, even fatal drop in blood pressure. This is why you must keep a medication list in your wallet. Tell emergency responders what you've taken. Now let's talk about daily aspirin, because this is where confusion and fear come in. The truth about daily aspirin, never stop, does not mean ignore your doctor. Daily aspirin has saved millions of lives. But here's the truth most headlines don't explain. Daily aspirin is not for everyone, but stopping it suddenly without guidance can be dangerous if you were prescribed it for a reason. Aspirin reduces clot formation. Stopping it abruptly can increase rebound clot risk in certain high-risk individuals. If you were prescribed aspirin because of previous heart attack, stent-known coronary disease, stopping suddenly can increase risk. But if you were taking it casually, just in case, without medical advice, especially with a history of stomach bleeding, ulcers, kidney disease, you need a doctor-guided decision. The message is not take aspirin blindly. The message is never stop or change heart medications without guidance. Now let me tell you a short real story, because this is where everything becomes real. Real life story. 1 small decision, 2 different outcomes. A 68-year-old man in Ohio, living alone, felt chest pressure one morning. He thought, I'll wait 10 minutes. He didn't unlock his door. He didn't chew aspirin immediately. He didn't sit down properly. By the time he called for help, paramedics had to force entry. He survived, but with severe heart damage. Now contrast that with another senior, 72 years old, living alone in Arizona. He felt chest pressure, unlocked his door immediately, sat down, chewed aspirin, used nitroglycerin correctly, called 911 early. Paramedics walked straight in. He walked out of the hospital days later. Same condition, same age group, different preparation. Say this with me mentally. Unlock the door early. Chew aspirin, don't swallow. Sit down, don't stand. Slow breathing saves heart muscle. Preparation beats panic. These are not tricks. These are time-buying actions, and time is life during a heart attack. If you're over 60, I want you to hear this clearly. A heart attack does not automatically mean death. It does not automatically mean disability. Preparation changes outcomes. Knowledge gives you control, even in the scariest moments. Tonight, check where your aspirin is. Check where your phone is. Check whether your door can be unlocked easily. Do these small things now while you're calm, because your future self may one day need the gift of preparation. Now we want to hear from you. Have you ever experienced chest pain or a heart scare while alone? What is one thing from this video you didn't know before? Comment below. Your comment might be the reason another senior survives. And if you believe this video could save even one life, share it, because heart attacks don't warn you, but preparation protects you. Thank you for staying with us. Stay prepared, stay empowered.